previously, in the CNS Pharmacology Masterclass, we talked about the anti-epileptic drugs classification, and we mentioned that we have a first-generation anti-epileptic drugs, which are also called the classic anti-epileptics or the older anti-epileptics. And we also have a second-generation anti-epileptic drugs, which are also called the newer anti-epileptics. And Topiramate is included in the second generation of the anti-epileptic drugs. Other examples of the second generation include the vigabatrin, the lamotrigine, the levetiracetam, the gabapentin, and pregabalin, and the tigabine. Examples of the first generation include the phenytoin, the carbamazepine, the valproic acid, the ethosuximide, the phenobarbital, and the benzodiazepines. So in our talk about the Topiramate, we will start with an overview. So a famous trade name for the Topiramate is the Topamax, and this is how the packaging of the Topamax looks like, as you can see in this picture. And Topiramate is a broad spectrum anti-epileptic drug that is used in treatment of different types of seizures. It is also used in migraine prophylaxis and in treatment of obesity. And Topiramate was first discovered in 1979 by the American chemist Bruce Marianoff, but it was approved for treatment of seizures 20 years after, in 1996. Moving on to talk about the mechanism of action of the Topiramate. So it works by blocking the voltage-gated sodium channels, and it also works by enhancing the GABA receptors. And GABA, as you know, is an inhibitory neurotransmitter. So enhancing GABA means more neuronal inhibition, and Topiramate also reduces the membrane depolarization by the AMPA kinase receptors, meaning Topiramate blocks the AMPA kinase receptors to some degree, and those receptors are the same receptors at which the excitatory neurotransmitters work, meaning that the Topiramate also blocks the excitatory neurotransmitters to some degree. Now, previously in the CNS Pharmacology Masterclass, we talked about on how to treat a seizure, and we mentioned that in treating a seizure, we either have to block the sodium channels or we have to enhance the inhibitory neurotransmitters in form of GABA. So we either have to enhance the GABA or we have to inhibit the excitatory neurotransmitters. And the Topiramate does all three of those. It blocks the sodium channels, it enhances the GABA, and it blocks the excitatory neurotransmitters to some degree. Now let's talk about the therapeutic uses of the Topiramate. So, as we mentioned, it has a broad spectrum anti-epileptic activity, so it can be used for different types of seizures, but it's mainly used in treatment of focal seizures and idiopathic generalized onset seizures and Lennox-Gastaut syndrome. Now, it is also approved for chronic weight management for individuals with body mass index over 30. So this medication leads to weight loss, and this is quite unique for this medication in comparison with the other anti-epileptics, because all the other anti-epileptics doesn't cause weight loss except for this one. It is also used in migraine prophylaxis, and it is used off-label in treatment of bipolar disorder and alcoholism. Now let's talk about the adverse effects of the Topiramate. So there is cognitive side effects to this medication, the same as with the other anti-epileptics because they work on the brain, so there would be some cognitive side effects. But with this medication, the cognitive side effects are quite common and they are the cause of discontinuation most of the times. So if the patient discontinues the medication, the cause is most likely related to the cognitive side effects. And the cognitive side effects include dysnomia, which is impaired ability to recall words, names, or objects. And there is also diminished verbal fluency, and there is general slowing of cognitive processes. And the cognitive side effects that occur with this medication are unique in comparison with other anti-epileptic drugs, and they occur without sedation or mood changes, and it is dose dependent. So the higher the dose of this medication, meaning the more cognitive side effects that come with the use of this medication. Topiramate may also lead to paresthesia in the start of the treatment, and it will improve with time. And it may also lead to fatigue, nervousness, and confusion. And it may also lead to angle closure glaucoma in susceptible patients. And it may lead to hyperthermia because of its negative effect on the sweating mechanism of the body. So it would decrease the sweating of the body, leading to hyperthermia. And hyperthermia occurs especially with children, and it may also lead to renal stones, and it may lead to significant weight loss with long-term use. And this adverse effect, the weight loss adverse effect of this medication, is used as a therapeutic indication to treat obesity. And this medication is teratogenic. If given during the first trimester of pregnancy, it leads to cleft lip. Now, it also leads to metabolic acidosis due to the inhibition of the carbonic anhydrase enzymes. So this medication also inhibits the carbonic anhydrase, leading to metabolic acidosis in the patient taking this medication. Now let's talk about the pharmacokinetics of the topiramate. So the topiramate is available as oral formula only, and the oral formula is well absorbed with 80% bioavailability, and the food minimally affects the absorption. Regarding distribution, 15 to 40% of the dose is bound to plasma proteins, and the rest is distributed to body tissues, especially the brain, where it exerts its effects, and 20 to 50% of the dose is metabolized by the cytochrome B450 enzymes in the liver, and it also metabolized by glucuronidation into inactive metabolites, and the rest is excreted and changed in urine. So about 50 to 80% of the dose is excreted and changed in the urine. The half-life of the topiramate is around 25 hours, and the topiramate mildly inhibit the cytochrome B450 to C19, meaning the other medications that are metabolized by this enzyme and they are co-administered with the topiramate, this leads to inhibition of their metabolism, leading to higher doses of these medications metabolized by the CYP2C19. Now let's talk about the drug-to-drug interactions that comes with the topiramate. So topiramate increases the clearance of the estrogen part of the oral contraceptive pills, leading to contraception failure in doses higher than 200 milligrams per day. So if the doses of the topiramate are higher than 200 milligrams per day, this may lead to contraception failure. Topiramate also interact with the metformin because both of them lead to acidosis, metabolic acidosis, meaning there is more metabolic acidosis if they are combined together, and also interact with other carbonic anhydrase inhibitors like acetazolamide, and the acetazolamide also lead to metabolic acidosis. So, and topiramate also lead to more metabolic acidosis, meaning even more metabolic acidosis. And the topiramate clearance decreased if co-administered with the amitriptyline, and the topiramate dose should be increased if combined with the carbamazepine. And with that, we reach the end of this video. Thank you guys for watching. Please make sure to like this video and comment your ideas and questions. And this video is a part of a bigger class. It's called the CNS Pharmacology Masterclass. You can check it out if you want.